excited to introduce Dr. Barney, a radiation oncologist in Provo, Utah. Hi, Dr. Barney, how are you?
I'm great. Thanks for having me.
I'm so glad that you're here. Thank you so much for coming to talk to us.
Absolutely, my pleasure.
Yes, so you are here to talk today about something I know nothing about, like not even a little bit, and
Okay.
that is called brachytherapy.
Right.
What is that?
So the brachytherapy, brachy means near, and therapy obviously therapy. So we're talking about a form of radiation therapy where we put a radiation source near the target. And so the target, what I usually do is treat cancer with radiation therapy. So brachytherapy is putting a radiation source close to or near the cancer to kill the cancer cells.
Interesting.
Yeah.
So are there certain parts of the body that this works better with?
Yeah, so the main areas of my practice are treating prostate cancer with brachytherapy, and then I also will treat gynecologic cancers with brachytherapy, or breast cancer also with brachytherapy.
Very interesting. Now, is this something that is typically done, or is it a relatively new therapy?
It's been around for a while, but in fact, the original radiation therapy was discovered by the Curies because they found they found that radium could treat cancer, which is the original brachytherapy, I guess. But the way that we do it nowadays is different, and it's evolved quite a bit, and the way that we're doing it now is, I would say, has been around for maybe 5 or 10 years at most.
Very interesting.
Yeah.
So yesterday, my dad and the rest of our family celebrated his 19th anniversary of being cancer-free.
Awesome.
Yeah, we were really excited about that.
That's fantastic.
His cancer was a brain tumor.
Really?
Uh-huh.
Okay.
And so it was a malignant brain tumor, and he flew back to Duke. They got 98% of it out, and then they did radiation therapy.
Okay.
So my guess is it probably was not brachytherapy. Is that correct?
Yeah, probably not.
Okay.
Probably not. So with brachytherapy, so there are a couple of different ways you can give radiation. You can give it with external beam radiation, which is from the outside in, and then brachytherapy, because we're putting the radiation source close to or next to the cancer, it's radiating from the inside out.
I see.
And so
you have to implant a device then that
Yeah.
radiates, is that right?
Yeah, so for example, in the treatment of prostate cancer, the way that we do it is in the operating room, and we give the patient an epidural block so they can't feel anything below the waist. And I actually put some needles into the prostate gland, and then we have a machine that will allow us to insert radiation materials into those needles, give radiation dose into the prostate through the needles, and then the machine will take the radiation source back out. And then I take the needles out after the procedure is done.
Oh, very interesting.
Yeah.
What kinds of results are you having with this?
Well, the results depend a little bit upon the stage of the cancer and patient risk factors and things along those lines. When we talk about prostate cancer, we kind of divide it into low risk, intermediate risk, and high risk. For patients who have low risk prostate cancer, brachytherapy alone is extremely effective, 95% chance of curing the cancer. For intermediate risk, we will oftentimes combine the brachytherapy with some testosterone blocking medications, or with some external beam radiotherapy as well. And if we do a combination approach with those treatments, then our success rate's usually about 85%. And for high-risk prostate cancer, we'll always combine brachytherapy with external beam radiation therapy and hormone therapy, and then the success rate's probably about 75%.
That's still very good.
Yeah, absolutely.
Very good success rate. That's excellent.
It's very comparable to what you would get with surgery or with external beam radiation therapy alone. The brachytherapy is often the choice that men have, or the thing that men choose, because the side effect profile is a little bit more kind.
I see. Well, that's good. So if someone were watching this video, for example, and wanted to find out more about brachytherapy or get in touch with you in order to undergo that procedure, how would they get in touch with you?
So they could call my office at Utah Valley. They don't need to be referred to me. I can see a new patient. My number is 801-357-2480, and they can ask for me, and we can usually get them in within the week.
Oh, that's wonderful.
Yeah.
Well, thank you so much for being with us today. It's just such a pleasure.
Thank you.